For consumers, dental work is mainly about practitioners and price, but it's also about business models which can make a difference in the quality and cost of care, especially over the long run. Likewise, dental students have to choose between corporate and independent practice or even setting up their own business. Our guest has set up her own dental practice, but was also the dental director for a health center treating underserved populations. She's currently the vice president of dental practice and relationship management for ADAPT. That stands for American Dental Association Practice Transitions. To tell us about the shifting trend in dental practice is Dr. Suzanne Ebert. Thank you very much for being with us, Doctor.
Thank you for having me, Chris. This is a subject that's near and dear to my heart.
Doctor, a lot of people my age grew up going to independent practices. Sometimes, the practice was known by the name of a single doctor. But what about the trend these days? It seems to be moving away from independent practice.
Yes, what we're seeing in the market is that we're seeing consolidation of those smaller solo practices. So we'll have a single doctor who owns multiple practices, or we'll even have a small group of dentists who own a large number of practices that are spread out in a very confined area. And then, of course, we have the corporate trend, which are private equity backed firms, and they are consolidating dental practices just across the country.
And how has the pandemic affected that?
Well, the pandemic has really affected everybody, as we all know. And with the smaller group practices, they are having some struggles in keeping employees. The dental assistants and the dental hygienists have not been as quick to come back to work. So some of the offices are really experiencing some major problems with just keeping open because they don't have staff. As far as the dentists themselves, they spent 3-4 months out of the office. So many of them experience some health problems, and they're concerned about coming back into the office and working a full schedule, along with all of the new regulations and requirements that they need to have in place in order to treat people safely. So what we are seeing is dentists who have been practicing for 35 or 40 years in those smaller independent practices, many of them are just saying, I think I'm going to accelerate my retirement plans. And on the flip side, we have some of our younger docs who have been in these dental service organizations. Well, many of them were furloughed, and it took a while to get patients comfortable coming back to the dental office. So many of them are actually saying, I think I want more control over my career, and they're looking to purchase some practices.
I want to ask you about how a non-expert would view these different categories here, because on the one hand, you think, well, with a corporate practice, you have size and maybe economies of scale. So what would be the advantage of an independent practice?
Well, a dentist has complete control over their own practice. They will have the ability to control the materials that they choose. They'll have the ability to control their collections policies. They'll have the ability, if they want to, donate dental services. It's their decision. As the practice owner and as the small business owner, they have that ability to make those tough decisions. If you are an employee, as with any employee, you will need to put those decisions in front of your boss. And if the owner of the practice or the corporation decides that they don't want to go in that direction, there's a lot less freedom that's involved. So really, the difference between having an independent practice and maybe being owned by an employee in a corporate practice, it comes down to just control over your materials, control over how you treat your staff, control over your schedule. So it really just comes down to your personal needs, your personal vision. If you want that control, you're probably going to want to gravitate towards an independent practitioner.
Was that your case? Because you started the practice from scratch.
I did. I graduated from University of Louisville and did a 1-year general practice residency. And I kind of always knew that I wanted practice ownership. To me, I knew that that was my path because I had been involved in a business before. So I had some business background. And I knew that I wanted that type of control over the way my practice would go. And one of the reasons I wanted the control over it was because as a mother of two small children, I knew that I wanted to be able to be there for them when they needed me. And I knew that I couldn't do that as an employee in somebody else's practice.
Well, if you look at national figures over the past 15 or 16 years or so, it seems that fewer younger dentists are going in that direction. Why is that the case?
Well, I think that they really don't necessarily understand their options as they're graduating from dental school. In dental school, they're exposed very, very much to the corporate environment, the corporate mindset, and they're graduating with an average of $300,000 in student loan debt. And I know personally of a couple of students who have gone up to $600,000 in loan debt before they graduated with their dental degree. That is going to change what you're looking at in that first couple of years out of school. Corporate America makes it very easy. Corporate dentistry makes it very easy for these young doctors to jump in and start making a pretty nice salary. So sometimes they get caught in that trap. Even if they say they want ownership in the near future, well, you know what? They get pretty comfortable, and getting out of that comfort zone can be difficult. So I would like to point out that when we talk with dental students, there was a recent study done, and 8 out of 10 of them want practice ownership. They just need to understand how to get there.
You know, it seems that in either model, there could be incentives for dentists to have people, buy more care than they really need. But is there any difference in the incentive if you're working in a corporate sector?
Again, I cannot speak to that very much other than to say that when you have control over your own treatment plans, you will decide how you are going to treat your patients and your staff. So what I recommend to every single customer that I talk to, every dentist that I talk to, and every dental student that I talk to who's looking to come into any practice, I say go in, evaluate the practice itself, evaluate the dentist that you will be working with and working for. Look at the treatment that's going out the door there and see if that's the place where you're going to learn to become the dentist that you always wanted to be. Because these dentists who are graduating from school, what they want is to be a high quality, comprehensive care dentist. And I can say that I have met no dental students over the last 6.5 years that hasn't embraced that. So they need to understand what to look for in a practice so that they go find one that provides that level of care.
Along with paying off their loans for college, these dentists have to think about reimbursement streams. And I've noticed that there seems to be less money coming to dentists who work in urban areas. Does that have something to do with the reimbursement mix, or what's the problem there?
For the most part, that has to do with competition and overhead. The competition in the urban markets, when you have 5 dentists in the space of a mile, there's a lot of competition there. A lot of their dollars have to go to marketing. So their overhead expenses are quite a bit more than, let's talk about a rural practice where the cost of living is very low and they're the only dentist in town. There are no other choices. They don't have to spend any money on marketing. Half of them don't even have a website because they don't need it. They're bursting at the seams with providing care and quality care to their patients. So it really comes down more to a overhead cost of living issue.
There's a gender shift in this profession as well. More dentists are women, that seems to have with it maybe more opportunities for mentoring and connections, but at the same time, how is that working out actually?
Well, in 2019, females passed males graduating from dental school. So we do have quite a bit more women in the dental field. And I, for one, obviously being a woman myself who's been a practice owner, I think it's a great opportunity. This is a wonderful time for women to be a part of this profession. And again, when you're a practice owner, you can control your schedule. You can spend the time with your kids. I know that I had I always think about the unexpected things that come up as a mother. My daughter was in 6th grade and she had a mommy and me thing, or that she wanted me to show up for. Well, I had a fully booked schedule, but guess what? I was able to rearrange things so that I could go be with my daughter in a time that she really needed me. And you can't replace those moments. So I think the profession as a whole is wonderful for females. We are very relationship-based generally. And I think that's only good for the profession.
Well, thank you very much for taking the time to join us.
And thank you for having me. I appreciate it.
That was Dr. Suzanne Ebert from ADA Practice Transitions.